Hey everyone, welcome back to the channel. So today what we're going to talk about is I'm going to show you guys how to use a very simple technique to self-diagnose your headaches and figure out whether those headaches are neck-related, musculoskeletal or not. And the interesting thing is we're also going to go through a very simple exercise which is very similar, it's essentially the same thing as the diagnostic technique. So this one really powerful idea will help you figure out potentially where the source of your headache is coming from, then give you the control to hopefully get it under control and to settle it down and fix it up without taking drugs, having to go through a bunch of medications, without potentially needing to see someone for it. Or if you're worried about a sinister cause of your headache, at the very least this can rule out a few things along the way. So if you can hang around to the end of the video, hopefully you'll get some really beneficial ideas out of this to help you conquer those headaches. So I think the first thing to talk about in regards to any headaches is that there are legitimately a small percentage of headaches and migraines that have a sinister cause, whether that's sort of brain related, neurologically related, or there can be some other more sinister undertones that sort of manifest themselves or express themselves with headache symptoms. Now, if you're stressed about those sorts of things, then clearly you need to go and see someone and get that diagnosed and sorted out. The positive that this video can also be for you, because if you are stressed about those things, you can use this diagnostic technique to either rule that out to a large degree, or at least give you some confidence that you can narrow down the list of suspects of what it could be, so that when you go and see someone face to face, you can say, look, I've done this, and this, and I'm confident that this isn't connected, and it might help you guys navigate a more sort of strategic path than before. But I guess the video itself is more for those people whose headaches fit into the general category, the musculoskeletal category that we see far too often. And basically what we want to talk about here is when we talk about neck-related headaches, there's a section of your neck from sort of a third of the way up, from sort of C3 up towards the base of your skull, where the nerves that exit those upper neck levels supply the face and head. So traditional headache symptoms like pain behind one eye or both, sinus pain, pain across your forehead, pressure over the top of your head, almost to the base of your skull, temple pain, all these sorts of aches and pains can be a referred pain from your neck. And it makes sense because a lot of the time these can be one-sided. They can also be vague, where you can't quite put your finger on where the source of your pain is, most likely because it's coming from a different area, somewhere that you can have a strong influence over. And before we get into the test and the exercise, it's also really interesting to note that there's a lot of facial symptoms that aren't headache specific, like lightheadedness, dizziness, sinus pain, which I mentioned briefly, jaw pain. There can be that sort of tick with your eye that flickers. You can have ringing in your ears. There can be all these general and random facial symptoms that we don't necessarily understand the cause of in the moment that can also be connected to your neck. So not only is this video hopefully helpful for people with headaches and migraines, but any facial symptoms that you feel, head and facial symptoms, do the same diagnostic technique, the same exercise, and see if it starts to undo some of those symptoms. So it gives you the confidence to know that, yes, this is where it's coming from. You're not going crazy. There's all this stuff that's going on here, but maybe it's coming from somewhere else. So hopefully you'll have some, this video will at least give you a clearer path to figuring out those things. So to get into it, the self-diagnostic test is really, really simple. And we've done something similar to this in the past on the channel. We use this technique a lot, but it's basically using a ball. So this is a tennis ball. You can use a lacrosse ball, a baseball. You want to use something ball-ish. Density is up to you. So if you are very tender, very, very much in pain, maybe a softer ball like a tennis ball will help you because it won't be as brutal. It'll be a lot nicer to do with it what we're about to do. But again, if you don't necessarily have too much tenderness when you use the ball, you can use something harder like a cricket ball, lacrosse ball, baseball, whatever you've got lying around the house. But the idea is that you use what you feel is appropriate because we want to make sure that you can spend some time doing it. So the exercise is very, very simple to begin with. So the first thing that we want to do before any diagnostic test / exercise, and remember they're essentially the same thing for this video, we want to do a test to begin with. So we want to make sure that we're doing something to gauge whether we've made some change. So obviously you can just take note of your symptoms. If you have a headache or some aches or pains somewhere, take note of how bad or good that feels. Second thing I want you to do is just move your neck. So we're going to get you to turn your head from one side, turn your head to the other. We want to take note of how far you feel it goes but then also what you notice when you do that. Does one side pull? Does one side jam up? And when you come across to the other side, can one side maybe go a little bit further than the other? Again, does it pull? Does it jam up? What do you feel when you do that? Do your symptoms get worse to either side? Because we're going to do the diagnostic test and the exercise at the same time, because it's the same thing. And then we want to retest it again to make sure that you feel like something's changed. So then you know that you're affecting the mechanical components that may lead to those neck-related headaches and migraines. So again, the exercise is really simple. What we're going to do is with the ball, we're going to press the ball into the back of your neck. Now, to show you from the front, it probably works easier down here. You can imagine that you've got the bony bumps down the middle of your spine at the back of the neck. So we want to place the ball sort of up the top in the middle to begin with, and we're going to let it roll off to the side. So we're not rolling all the way around the side of the neck. We're just going to start on the bump in the middle and just roll off the bump onto the column of bony tissue and muscular tissue that's there. We're going to let the ball press in for a little bit, get a sense of how stiff and tight it feels, if it's tender, whether it reproduces or decreases some of your symptoms. Then we're going to compare the exact same spot on the other side and run that test again. Let the ball press in. We're then going to get a sense of whether you notice any symptoms. Does it increase or decrease? Does it feel stiff, tight, or tender? So how that looks is, again, we're going to place the ball to begin with right at the top of your neck at the base of your skull in the middle, and let the ball just roll off to the side a little bit. So again, remember, we're not going all the way around the side. We're starting in the middle, rolling off to the side. What we're going to do here is we're going to lie down on top of the ball. Now, you can do this obviously leaning up against the wall if you want to, if the floor's not comfortable. You can do it sitting on a chair, it's the same thing. So once you're in the middle and you've rolled the ball off to the side a little bit, what I want you to do is you're going to have to turn your head a little bit to that side just to stop the ball from sliding out. But all I want you to do here is move it around, go looking for something that feels a little bit stiff, tight, or tender. So for me, I've got a tiny little bit here. All we're going to do here is just stay here. So the exercise itself is letting the ball press in for 30 seconds, 40 seconds, as long as you feel it takes for that, the symptoms that you feel to subside. So if it feels tight and stiff, we want it to feel less tight and stiff before you move on to the next area. So the reason why this is the exercise and the diagnostic test at the same time is that the retest that we did at the start with the neck movements, if you push on a particular spot and you automatically feel all of your headache symptoms, then the spot that you're on is the area that those symptoms are most likely coming from. So not only are we trying to free up that area, but we're also trying to take note of what's happening with your symptoms. So for example, if I move it down a fraction lower, so I'm about sort of C3 here, again, rolling off to the side, feels a little bit stiff and tight for me here. I don't get any headachy aches or pains. I get maybe a feeling of like a pressure behind my right eye. Again, nothing too sinister, but if that was one of my symptoms, then I know right now that the other side, the left-hand side which I'm on, needs to give for those symptoms to change. So again, all the exercise is just lying down, letting the ball press in until you feel like you've done something. Then you want to move the ball down, up, or out to the side a little bit more to go looking for the next part of the puzzle. And then once you've done that, as I said, what's really important to do is to, again, take note of how you feel. So for me, my head feels a little bit lighter, it feels a little bit less sort of pressure there. And if I turn my head from side to side again, so going to this side automatically feels nicer. It doesn't feel like it jams up at all. It feels a little bit sort of less pulling on this side. And again, it doesn't feel like I'm jamming up as much when I go to that side. So I don't have any nasty neck symptoms or headaches to begin with, but there are some subtle undertones of dysfunction there for me that can clear up pretty quickly. So the benefit of this diagnostic test / exercise is that in real time, you can go hunting around both sides of your neck from sort of the mid neck or the top third of your neck up, right up under the base of your skull where the musculature is. All of that area is fair game. Sometimes you might need to come all the way out from where your skull meets the top of your neck. Sometimes if you come out a little bit wider towards just behind your ear, right at the base of the skull where there's some muscles that insert in there, sometimes those muscles can be generating some of that tenderness as well. So then those headache and migraine symptoms. So it's really powerful to be able to go hunting through your neck, looking for the areas that feel dysfunctional, and then matching that up with the symptoms that you feel day to day. Because as soon as you hit a spot that increases or decreases with that area, as soon as you hit that spot that communicates with something that you feel day to day, you can have a lot of confidence that that's where a lot of those symptoms are coming from. And as soon as you can free it up and restore normal motion to those areas, then you should feel a resolution in those symptoms. So again, if you're someone who suffers from nasty headaches daily or weekly, or they keep coming back, or you're just not sure why you get a headache when you get one, it's very likely that it's going to coincide with some increased dysfunction in your neck, and the headache is just an expression of that dysfunction. So we can take all the pills, we can do all the facial stuff that we want to, but unless we're addressing the stiffness and the tightness and the overloaded tissue at the base of that skull, the top of the neck, we're potentially failing to get to the underlying cause of those headaches. So clinically, anyone who comes in with headaches and migraines and things like that, probably, if they haven't been through all the medical testing, it's a really good screening test to say, look, if we free up these areas and your symptoms feel better straight away and go away, we can have a lot of confidence that those symptoms aren't going to be due to something more sinister. But again, there's no point taking a risk. If you see someone or you do this exercise and you're not convinced, make sure you're doing the exercise correctly, and you'll know that by feeling that your range of motion improves afterwards. You may not feel horrible to begin with, but you should feel even less horrible again once you've done the exercise in terms of your range of motion. And if your range of motion has improved in a lot of different ways, but your symptoms are still very similar, then of course it might be a good chance to go and see your doctor or see a physical therapist in person to discuss what your options might be. But I think the ball exercise into the neck is a really valuable tool to instantly pick up on whether your headache is neck related, and then work on that for 10-15 minutes to resolve those headaches quickly. So you're not having to wait for a couple of hours for drugs to kick in, or a couple of days for things to magically go away. You have some direct control over your headaches and migraines if it's neck related, and you can figure that out really simply with the ball. So again, hopefully that's really useful for those who struggle with headaches. I know it's tough for a lot of people. It's very impactful on your quality of life and getting things done. They suck to have. So any tool or approach that can help you regain some control and get those symptoms under control more quickly is really beneficial. So give it a go and let us know how you go in the comments below. Let me know if it's helpful. Let me know if you're struggling to figure it out, and we can help guide you a little bit more. And of course, as always, if you did go on to enjoy the video, please consider leaving a like below and subscribing to the channel if you are new. It just helps these videos get out to more people, and it helps support us and helps us grow so this information gets out to more people, as I said. So as always, thanks for tuning in. Good luck with this, and we'll see you in the next one.